something which is very important across all the branches of medical science is the concept of consent. So what happens is that it is one thing to just get the patient's or the relative signature. It is another thing, and equally important or more important is to make them understand what you're going to do and what is it going to be like. See, what happens is that in the government setting, because of shortage of time or whatever it is, maybe we don't spend enough time, and somehow sometimes we get into the habit of taking things for granted, and that can actually backbite once you come to the private practice. One such scenario is that I remember we used to, whenever we used to as residents take the patients up for decompressive craniotomy, we used to tell them about the procedure, but at times we used to forget to tell them that where that bone is going to be, because sometimes we can keep it in the abdominal subcutaneous space, or we can keep it in the bone bank, or whatever it is. So these are few areas. Later we realized what where all things can go wrong, and then we understood the seriousness of that. So in case if you're doing a decompressive craniotomy, always make sure to tell the patient that the bone will be temporarily kept in the abdominal subcutaneous space, and later it is going to be replaced back. Similarly, if you're doing a spine procedure, and if you're planning to remove the iliac crest bone as a bone graft, again make sure to tell them that there will be another incision either on the front side or the back side at the iliac region to remove the bone graft. Tell them why it is important, what exactly are you going to do with that bone, because what happens is, if your luck is bad and if the patients don't get the expected result, the result according to their expectation, then they can start any kind of drama. They can tell you there is a new incision on the abdomen, so kidney le liya, they have removed the kidney. It can happen for decompressive, it can happen in case of even iliac crest. They have no idea what is the incision for nephrectomy, but they will still say that the kidney has been removed from the front side of the abdomen, not from back side. So these things can happen. It is very funny for us, but in case if they take it to a larger extent, it can be problematic. So that is why always make sure that you tell this thing in advance, you make them understand, and if possible always have a video recording of you taking consent, obviously along with the audio. If not, at least carry your own phone and keep the audio recording on in that, if not video, so that tomorrow if some situation comes, you at least have the proof that you had told so and so things. And obviously make sure that you interact with them, you make them talk if you're doing the audio recording. This is something which I've been doing for past 5 years. I would advise all the juniors also to do the same. Always keep a record of what you have explained to the patient before the operation, and of course, needless to say, explain every possible thing, every possible complication. Don't think that agar maine aise bol diya to they will run away. No, don't think that. Tell them all the possibilities, because you don't know who is what and when. Thank you.